Hello and welcome to another episode of the Philly Public Health Chats. Today we're diving into an important and very sensitive topic as we recognize September as Suicide Awareness Month. Our guest today is Megan Driesbach. She is a licensed clinical social worker with over 11 years of experience working with families and individuals across various settings, including hospitals, primary care clinics, and community programs. Megan holds a Master of Social Work from Colorado State University, and she has a wealth of expertise in crisis intervention, suicide risk assessments, and therapeutic techniques like cognitive behavioral therapy and dialectical behavioral therapy. Throughout her career, she has worked extensively in mental health emergency departments, partial hospitalization programs, and community support initiatives, providing crucial support to those in need. Megan has a deep understanding of the complex factors surrounding mental health and suicide risk. This makes her an incredible resource for today's conversation. We are grateful to have her with us today to shed light on suicide prevention, recognizing the warning signs, and how we can support those around us during difficult times. Hello, Megan. How are you?
Good. How are you?
I am well. So, September is Suicide Awareness Month, Suicide Prevention Month, and bringing you on to talk a little bit about this very important topic and something that has affected millions, if not billions, of people already around the world. Suicide and suicidal ideation, and people who attempt a suicide, and people who die by suicide, and the repercussions. I want to talk to you about the signs of somebody who is going through suicidal ideation. And let's talk a little bit about the definition of what it is to be suicidal. What is suicidal ideation?
There are different types of suicidal ideation. If we go by least to most serious, kind of least serious would be what is considered passive death wish or passive suicidal thoughts, which is when people don't want to be alive anymore. Like they just want to go to sleep and never wake up, but they have no actual intent to kill themselves. It then progresses to active suicidal thoughts, which is where people are thinking, I want to kill myself, and then progresses to making plans. So people start thinking about, I am going to kill myself by overdosing, shooting myself, or like hanging, things like that. And then it moves on to suicidal intent, which is where they are planning to follow through with their thoughts and plans to kill themselves.
So, one of the things that often comes up when I discuss this with other folks in the mental health field is the difference between your teenager who says, I want to kill myself, or I can't do this any longer. And as a parent, we often hear that from kids in a joking manner, but then they get to be teenagers and it starts to worry us. So, when should parents really worry that there might be something there that they need to intervene?
I think with children and adolescents making like suicidal comments, it's important for parents to pay attention to whether their child has started to withdraw from activities that they used to enjoy doing or things that they used to do, like going out with friends or going out to movies and things like that, because that is a pretty typical sign of depression. Also, if they're talking about, I want to kill myself and I've thought about, taking pills or things like that, that's a little bit more serious. A lot of times kids have told their friends information about wanting to kill themselves or things like that. And if they're messaging their friends with suicidal statements, then I would encourage parents to take it more seriously. There's also conditional suicidality, which is if you don't give me this, I'm going to kill myself. And that one's difficult because for the most part, conditional suicidality is not one of the highest risk factors for committing suicide. However, I've also heard stories of children that made conditional suicidal statements and then did end up killing themselves.
And when parents are worried, who should they reach out to?
They have a lot of options. Obviously, they have 988 for the National Suicide Hotline. There's also law enforcement. Say your child has made suicidal statements and you can't figure out where they are. You need to be calling law enforcement to help look for your child. There's also usually hospitals, emergency rooms. Those are if a child is saying that they're going to kill themselves and they have a plan and intent, parents need to take their child to the emergency room to find the closest hospital that can meet that need if they're in imminent danger. Otherwise, nowadays, there's lots of online platforms for mental health services. And then there's always community mental health services. So outpatient agencies and things like that, where they can start accessing therapy or medication management. I also like peer support. So peer support is people with lived mental health experiences And I find that can be very beneficial to families to have like another parent that has gone through something similar to support them. And then there's also always support groups through the National Association of Mental Illness holds support groups. And then there's often individual support groups in different cities.
Can you tell me a little bit about the influence of social media in the suicidal ideation or suicide attempts in teenagers?
Yes. So they have shown that social media use is correlated with a rise in anxiety and depression. They also did a study one time where they had adults sign up for TikTok as if they were 13-year-old girls. And they found that within 30 minutes of being on TikTok, the girls were referred to videos that were referencing eating disorders, self-harm, and suicidality. So yes, the use of social media is unfortunately linked to an increased risk of suicidal thoughts and plans and intents. What they also show is that when people talk about others committing suicide and how they commit suicide, such as when we have actors or famous people kill themselves, they've shown that that can actually link to a higher risk of suicidal actions because people have heard about it, they heard how it's done, and then they often act on it.
Yeah, one of the things that I walked into in one of my public health jobs was the tail end of a suicide cluster associated with a few high schools in a very affluent county
Okay.
in the Mid Atlantic states. And this place, people didn't want to recognize that there was a cluster going on. That each child who had died by suicide knew at least one other who had died by suicide, and it was spreading. And it wasn't
Really?
until the experts came in and explained it to them that they needed to cut that chain, that they really got rid of it. For now, I guess it's very likely because of the social conditions of this place, very highly competitive educational system, very difficult to get into some of the schools. And then the cultures that are there in terms of places where people come from in other parts of the world also are not helping, when children are told that they better get into college or else, it
Mhm.
just causes a lot of pressure to them. So, what can you tell me about firearms? What is the role of firearms in the risk of suicide, especially in homes where firearms are a part of daily living, a part of the home structure and culture, and where children have access to those guns?
So thinking about firearms, it is recommended that if somebody is talking about suicide, that firearms are removed from the house, placed in somebody else's house, or that they are locked up with ammunition stored separately, and that the person who is experiencing suicidal thoughts does not have the knowledge of how to access them. Also, if children are talking about like overdosing or cutting, removing access to medications or vitamins and minerals that they can overdose on, remembering that even some of the most common like safe medications are some of the most dangerous, such as Tylenol. And then also, if they're talking about cutting themselves, remove access to sharp objects like knives and razors. If somebody has attempted suicide, it is recommended that the safeguarding measures are taken for at least 30 days in the home. However, once again, if somebody's talking about having a plan like that and that they have intent to act on it, that's the time that they need to go to the emergency room.
We often hear about suicidality strongly associated, right, with depression or some other psychiatric condition. Does the average person, and I mean, using the word average very broadly, does the average person have these kind of thoughts in their head of, maybe the world will be better off without me? Like if somebody, yeah, because I'm thinking of somebody who thinks that for a second, and then all of a sudden they just start spiraling because they think that they have issues. Should they explore that further as far as getting help or reaching out and talking to somebody?
That's a good question because a lot of the patients that I work with, they do experience passive suicidal thoughts or passive death wishes. They don't actually want to kill themselves. And exactly what you said, sometimes the passive death wish actually makes them question more and they have an anxiety and things like that about it. I would say that if they're having that thought and then they're worrying excessively about them having that thought, it would be time to go talk to a mental health professional and receive some education on passive death wish is not active suicidal thought, plans, or intent. And so it's a little bit different. And it's something to still worry about, but not as extreme as if somebody is expressing suicidal intent.
And you talked about receiving some kind of therapy or some kind of assistance, some kind of medical treatment for this. What are those? What does that comprise? What would somebody have to look forward to when reaching out for help? Let's just say this person managed to get themselves to the emergency department to seek help.
I think it depends on what type of emergency department they go to. Obviously, I worked in a mental health emergency department. So what we did was we did a suicide risk assessment to determine whether someone was in imminent danger to themselves or others. And then if they were not in imminent danger to themselves or others, we would discharge them with hopefully community resources that they could access and set up outpatient services, or we would refer them to higher level of care like partial hospitalization services, which are programs where patients come during the day. It can range in the length of time where they can receive services not only such as therapy groups, individual therapy, and then also medication management, normally from psychiatry.
And then finally, if you had any word of advice for a large number of people listening on a podcast about recognizing the signs of, and we talked a little bit about parents recognizing the signs in their children, but just recognizing the signs of suicidality in a coworker and somebody that they see almost every day. Maybe they don't have the personal relationship with that person, but they see them and they interact with them at work or on some sort of social level. What is the advice you would have for them to recognize and act upon something that they see?
Recognizing it would be similar to how parents would recognize it with their children. If you notice a coworker has started to have hygiene decline, they're not as interested in work, they're not doing work to the level that they used to do. And if they stop talking about future planning. So say they have a big project that's due in a couple months, but they've stopped talking about it as if it's no longer important, they're not going to do it anymore. That is a huge risk factor. And what I would encourage people to do with anybody where they're noticing these signs is to ask them how they're really doing. It's not the superficial, hey, how are you today? But hey, how are you really doing? And if somebody is to express suicidal thoughts to you, not to overreact or underreact, react in a way that's supportive of the patient or person. And then also ask them, are you thinking about actually killing yourself? So a lot of us have been told that like talking about suicide is more likely to make somebody commit suicide. And they've found that that is a myth. What is true is that if somebody is thinking about killing themselves and you ask them if they are, they're more likely to tell you. And there's also a lot of trainings out there. There's mental health first aid, there's QPR training. So if people that do not work in mental health are interested in getting more training on how to recognize the signs of suicidality and how to respond, those are good trainings out there.
Yeah, we'll link to those trainings in the show notes. Let me end this by thanking you, Megan, so much for joining me on this podcast. If you or someone you know is having thoughts of suicide, or you just want to reach out and get some help, 988 in the United States is a suicide hotline from any phone, even phones that are not actively connected through a carrier. It's just like 911. You just dial 988 and it'll direct you to somebody. 911 as well. If it's imminent, I highly encourage you to just get fire EMS and police moving, and we'll worry about the details later. Anybody who's listening, if you have any thoughts of suicide or self-harm, please know that there are people willing to listen. Please reach out. You're worth sticking around and seeing what other things you have to offer the world. And so thank you so much, Megan. Thank you. I really appreciate it.